The Neonatal Intensive Care Unit here at DCH Regional Medical Center has been in operation for more than 25 years. With a staff of 3 neonatologists, these are doctors who specialize in sick and premature infants, 4 certified registered neonatal nurse practitioners who provide around-the-clock medical care and support for these babies, and a staff of specialized trained registered nurses. If your baby is actually admitted to the Neonatal Intensive Care Unit and requires the specialized care of our facility, you'll notice that the first bed the baby's going to be on is going to be a radiant warmer. And what the radiant warmer is for, it gives us access and a lot of visibility of your baby in the first 24 hours or the first days when it's so important that we're able to see your baby very well. Once the baby improves a little bit, he may move from the warmer into the isolettes. These are the isolettes, where we can also do a day and night rotation for him so he's not always in the light. And it gives him an environment that he stays warm in until he's old enough and big enough to take care of his temperature regulation by himself. The next move that he would make from an isolette would be into an open crib. So let me show you what the open crib looks like. This is the open crib that your baby will be in right before he goes home. Once a baby has matured enough or his illness is over with, then he's able to go into a crib where he can keep his own temperature up. He has to be able to gain weight out in the open crib, and he also will be feeding with a bottle by the time that he gets ready to go home. If your baby is not able to feed, because a lot of babies who are sick or who are immature are not fed immediately, we will give them IV therapy to keep their nutrition, their calories, and their fluids up. The first IV that you might see would be in your baby's hand or in your baby's foot. If your baby's sick enough to need more than just IV fluids for the couple of days, you will see IV tubing in the baby's umbilical stump. So let me show you what that looks like. This little girl has the peripheral IV that I was telling you about. Might be in the baby's hand or in the foot. It's actually in her hand. You probably have the exact same thing in your hand since you've just delivered a baby. Now, babies who need fluids for more than 1 or 2 days are going to be on fluids for several weeks. A lot of babies who are very sick or who are very immature will need this, will have the IV actually in their belly button. And when you come in, you may see this. This is what the lines look like in your baby's umbilical stump. Doesn't hurt them at all. And one of the lines is in an artery, the other one is in a vein. That allows us to be able to draw any kind of blood that we need from the baby without having to stick him with a needle every time. And the other one allows us to give him all the nutrition that he needs. Babies who need IV nutrition for more than 2 or 3 days will be on something you'll hear us call Hyper-Al or TPN. That is a special fluid that we give the baby through their IV that has all the protein, the sugar, the calories, and even fats that they need so they won't lose weight while they're getting better from whatever is wrong with them at the time. This is the pump that's actually hooked to the IV fluids and is delivering the fluids to the baby. So if your baby has an IV, you'll also see this, and the tubing runs down the counter and into the baby's bed. Once your baby begins eating, he may not be big enough, mature enough, or well enough to suck a bottle. That takes a lot of energy for a baby to breathe, suck, swallow, and get all of those things coordinated so that he doesn't choke. So a lot of times the babies will be fed with a tube first. The tube will go in the mouth and down into his tummy. Let me see if I can show you. Yeah, he's got one. This little tube right here, orange tube, goes into the baby's mouth and down into his tummy, and we'll feed him that way. We'll hook it up to a syringe. The formula is hooked to a syringe, and we push a little bit at a time. If you're interested in learning how to do this feeding for your baby, we will be happy to show you how to do it and monitor it until you feel comfortable doing it. We'd like for you to be able to do as much of the care for your baby as possible. Once the baby is able to eat with a bottle, then there'll be a nurse to help you with that too, show you how to get the bottle in the mouth, how to burp, how to lay the baby down after a feed. There'll always be somebody right there with you. If your infant requires any help in breathing, there are several different ways that we can do this for your child. The babies who need the most help breathing will be on a ventilator. This machine right here is your ventilator. The numbers on it are just showing us how many breaths we're giving the baby, how much pressure we're using, how much oxygen we're using, and we'll be glad to explain that to you if you're in here and your baby is on a ventilator. Now when I'm talking about a ventilator, I'm talking about a baby who is actually intubated. What intubated means is there's a tube in the baby's mouth that goes down the windpipe and into the baby's lungs. When the baby is on a ventilator like this, we are actually breathing for your baby. So if you can come in a little closer, you can actually see the little tube that's going into the baby's mouth and down into his lungs. And so it's giving him somewhere usually between 5 and 60 breaths every minute, depending on how much support your child actually needs. It's hooked to this tubing that goes into the ventilator. Every 2 to 4 hours, especially in the first days that your baby is on the ventilator, we'll be taking blood from your baby and checking to make sure there's enough carbon dioxide, enough oxygen, and that we're not breathing too much for your baby or not enough for your baby. This is how we regulate that. Now once the baby is better and can breathe a little bit for himself, he may move to something that we call Nasal Imv or Cpap. You may hear some of the nurses call it Cpap. What that is a little hat on the back of the head, and it comes around and there's prongs that sit right inside the baby's nose. Let me show you what that looks like. This is Nasal Cpap or the Nasal Imv. You'll notice that he does have a little cap on the back of his head with the ties that come around the front of his face, and prongs sit right inside the baby's nose. Let me put these back in. And it's still hooked to the same machine, the same ventilator that we just showed you. The only difference is your baby is able to breathe a lot on his own, but still needs the pressure support and maybe some of the oxygen, and that's the way that we're delivering it to the baby through his nose. Sometimes this becomes a little bit uncomfortable for the baby, so we have a cream that we put on their nose that kind of deadens their nose. It keeps them from fighting it. But this is the second step.